Hi, everybody. You're watching White Mountains TV. It's another Zoom interview. This time I'm joined by the president of Memorial Hospital, Art Mathisen. Thank you for joining us this morning, Art.
Thanks for having me, Chris.
And we're going to talk a little bit about Memorial Hospital's role in our community. You guys obviously are playing a huge role these days with the COVID-19 epidemic going on. Let's talk a little bit about, let's start from the beginning. Obviously, Memorial Hospital has always been kind of the center of our community, the center of maintaining a healthy community. But your focus has kind of shifted now that the pandemic is here. Tell us about the early days and how Memorial Hospital prepared and changed their whole business operation, really, to accommodate our new health needs.
Right. Yes, exactly. There were monumental changes that me as a senior healthcare leader, and I've been in a number of positions over 25 years, have never seen anything quite like this. I don't think any of us have, and never would have imagined something like this that would require such broad, sweeping changes and preparation that would take away from what I call non-COVID care. And so really we started listening very intently in mid to late January. And that was a result of Will Owen, which many people in the community know Will. He's our emergency preparedness manager, kept whispering in my ear that we need to pay attention to this. And so in February, we started attending certain conference calls and really watching it closely, and started talking about preparing, and started our checklist of how we were going to prepare for this. And in early March, we stood up our emergency operations center. We called a code white for the entire hospital, which basically puts everybody on notice that we are not in normal operations. And because of the smart people that we have, the great team that we have here at Memorial, we prepared relatively early and very thoroughly. But one story that I still remind our senior team on is, me coming from the Army, this is kind of the element that I'm used to, preparedness. We're just obviously preparing differently or for different things in the Army, but still it's very similar, and you can't plan enough and you can't plan early enough. But we were in one of our emergency operations center meetings, and it's a bunch of staff, the senior team, and I brought up maybe we should set up a COVID tent. And people laughed at me initially because they thought it was overkill. And what I remind them, and have reminded them several times, is, hey, that tent doesn't sound so funny now, does it? And we all laugh, and it's just me teasing them, because we put up a second tent about a week after the first one. And usually with this kind of preparedness, Chris, this is what I go by. If you feel like that you're over planning, you may be just doing enough or not enough. Fortunately, we prepared very well. We had the capacity to expand to many beds above and beyond our normal 25 here at Memorial. We have not seen a surge to this point, but I don't think this is over yet, and I hope it doesn't happen, but we're certainly prepared if a surge does come, as we start standing up our community and our businesses start getting going for the summer season.
Well, this gives me a whole new impression of Memorial Hospital. I think most of us think of the hospital as a place we go to visit our primary care. We have elective surgeries there. If there's an emergency, we go to the emergency department. But this has really kind of cast the hospital's role in the community in a whole new light. And that preparedness element really makes me think, how often, how unique is this COVID preparedness? Have there been other incidents that you guys are constantly, or other epidemics, or just other things that you guys are constantly surveying and monitoring and thinking about how you might need to react if things escalate?
Yeah, so Great question on that. And I'm thinking back throughout my career on different times that we stood up the Emergency Operations Center for a real world event. Never, in my experience, for something like a virus, do we stand up the EOC for now probably the longest, arguably in the history of our hospital, have we been in a code white with the Emergency Operations Center up and running. A lot of times when you go to a code white, stand up the EOC, is for things like, say, the unfortunate occurrence of a bus full of students rolls over, and you have a mass casualty situation of 30 people coming to your hospital. Or, in the Midwest, hospitals that dealing with a tornado rips through a town. So those type of things. But never have we dealt with something like this, that we were unsure of the magnitude as far as the total numbers that might need to come to our hospital for inpatient. And I don't think anybody exactly knows what the future will bring. Certainly we're looking at data and trending that data, but I still believe we need to be prepared for worst case scenario until we're absolutely sure that we're on the backside of this. And right now, if you look at southeastern New Hampshire, you'll see that the numbers are still relatively high down there, and we still have over 100 patients that are positive for COVID in our hospital beds throughout New Hampshire.
What is our community looking like right now? You mentioned southeastern New Hampshire. What
Right.
about Mount Washington Valley and the North Country in general? Have we seen as many positive patients as we thought? What's the trend right now?
So our trend is quite flat and has been, although I always have a concern about working off of a very small sample size, right? It oftentimes doesn't give you the best trending ability. However, we're at 35 total positive patients in Carroll County as of today. And so that's a pretty low number. We're actually right now the third lowest number of positives of any county in the state. There are a few other hospitals that are in the low 40s. The two lower hospitals are one's in single digits, and I believe one's in the teens. And then it goes up increasingly from there, with more of the southern hospitals, which makes sense, being closer to metropolitan Boston probably is the main reason. Numbers are much greater as far as per capita, et cetera. So we're doing pretty well. I think the phased approach that the governor's 2.0, I think that's a good thing, as far as not going from 0 to 60, as I've been saying, not going too quickly with this, but a phased approach. And then, we're in phase 1 right now, and we kind of look to our left and our right and wait a couple weeks and say, how are things going? What's the data look like? And if things remain relatively flat or start decreasing, then we consider going to phase 2 and then phase 3. And I think that for the hospital is the best, instead of just completely opening up and allowing the out-of-staters, carte blanche as far as what they can do here in the Valley right away. Understanding, of course, that, and I've said this before, and I feel for our businesses, many of them that I frequent on a regular basis with my family, and the struggles that they've been going through. Certainly understand that. And I've been asked by community leaders, what can the hospital do? Does the hospital have the capacity to support a phased opening? And my answer is absolutely. Our team is ready to support that, and we're ready to expand if we have a surge in COVID inpatients, and we certainly can do that. Obviously, we're part of a larger system, Maine Health. Maine Medical Center is our tertiary care hospital. We certainly can get help from them if it gets out of hand as far as total number of COVID patients. But we're ready to support this effort as the community starts opening up.
And so what is your focus right now? As the community starts to open up, I believe the governor's has given healthcare systems the leeway to start to investigate whether they want to add certain procedures back into their, the fold. Are you continuing to monitor before you do that, or what do you think the timeline is before elective procedures come back to Memorial Hospital, or are they already coming back?
Yeah, so this is something we've been talking about and preparing for a while now, in waiting for the governor to put his plan out. And so Friday afternoon, a week ago, we were waiting for the 3 o'clock to hear his plan and then get it in writing so we could make sure that we're doing our best to follow those guidelines. And the other piece is it's fortunate that the guidelines with Maine and New Hampshire, although they're not exact, as from a healthcare perspective, they're in line with one another. And so we were glad to see that, because being part of Maine Health, the majority of the hospitals are in Maine. We are the New Hampshire arm of the Maine Health system. And so I've been waiting for both guidance to come out from both governors. And essentially, this is their guidance, is time-sensitive care. And what that means is something that you or I might have needed for care 2 months ago, our clinicians may have said, yeah, that's not really essential right now. Because once we started moving into this COVID preparation, we stopped doing anything that was non-urgent, non-essential. So anything that was deemed elective, we essentially stopped. But some of these non-essential type of procedures and outpatient appointments, et cetera, that were not time sensitive, were not urgent 2 months ago, now are urgent or are time sensitive. And so this is really a clinician driven process to determine what patients really need to get that time sensitive care. And so in each of our areas, our surgeons, our primary care physicians, our nurse practitioners, PAs are working with our administrative leaders to determine those patients that need to either get care via telemedicine, like you and I are talking right now, but really a lot of the care needs to come back into the hospital. Telemedicine is great for a number of things, but right now a lot of our patients need to be pulled back into our hospital, understanding that we are as safe as any hospital in America. We are putting face masks on everybody that comes through our doors. And my comment is, if you're a human being, you're coming into our hospital, you get a mask. And so that increases the safety level exponentially because of that. I guarantee if you and I are going to a number of places, anywhere around here or in Portland, not everybody's wearing a mask. But we're committed to making this safe. And one of the most important things you can do is wear a mask, social distancing, 6 feet if at all possible. Even if you have a mask on, better safe than sorry. Wash your hands, and don't touch your face, which for me is like one of the toughest things. And in meetings, I sit there and watch people, and everybody touches their face. It's just what we do. And so changing habits is not easy.
It is. I noticed it the other day myself. I got in my car after going somewhere, and the first thing I did was, I think, scratch my nose or something like that. And I was horrified at myself, something that I wouldn't have thought twice about, just a month or so ago.
Right. Exactly.
Let's talk about, as the economy starts to open up, we hope it doesn't happen, but I think we have to expect it will, that cases of COVID-19 will start to tick up. So what should someone do? What would be your advice for someone who thinks they have symptoms and might have COVID-19?
Well, there's a couple of things. If somebody thinks they have symptoms, they call the hospital, and we'll give them guidance. Sometime in the past, when our guidelines were very limited on who got tested, a lot of times in the past we were telling patients that had mild flu-like symptoms just to stay home. And a lot of that is because they have mild symptoms, but another part of that was our testing capability throughout America, and that's not news to anybody at this point, and I believe it was accurate that we did not have a lot of testing capability anywhere. Now that has improved greatly, so there would be a very good chance that if you called and said, I have these symptoms, that we would say, come to the hospital. We actually set up very early on a process where you could get swabbed in your vehicle. You don't even have to leave. And what swabbing is, as I say, they tickle your brain. So you have to basically put a swab up your nose pretty high. And I had it done myself. It was okay. I don't want to get swabbed every day, let's put it that way. But it was a necessity to get tested because actually I was in a situation where I had signs and symptoms. I'm a healthcare worker. That falls within the guidelines of the Department of Health for testing. My chief medical officer said I had to get tested and had to go home for the day. And I begrudgingly did that and followed his directive, and I was negative. I was just feeling, not too great that day. And so that's a very slick, seamless process to go through. Essentially, that's our expanded emergency department using one of our 2 COVID tents. But if their symptoms were worse than mild or medium, if they were at the higher level, very severe, then we'd likely take them not just into our COVID tents, but we'd probably take them into our facility, mask them appropriately, and then look at next steps, which could lead to them being an inpatient. And so right now, that's the option. I think people probably have read and know about that we do have the state-run Tamworth testing facility. And that facility, it's my understanding, has much broader guidelines for testing. Essentially, anybody that wants to go get a test there can do so. We have different guidelines because of our tests and what we're using those tests for in providing the care that we're providing every day.
I believe the facility you mentioned in Tamworth, is that the DMV? Is that where that is?
Right. It's right beside the DMV. It's in the same vicinity, the parking area. Yep. It's one of the initial 5 that the governor set up in order to increase testing. And he set pretty good goals on number of testing per day. And so a lot more people are being tested. And I really appreciate the work that our state has done and our local community as well to get those tests that we were in dire need of early on as this moved forward and really started ramping up throughout the United States.
All right. We're talking with Art Mathisen. He's the president of Memorial Hospital. Before we let you go, and I know being the president of a hospital keeps you very busy these days. I'm sure there's no downtime. But I want to talk about your staff a little bit. Healthcare workers have really stepped up to be on the front lines, as we all know. For many of them, this is a new experience. I know many healthcare workers who are suddenly, wearing all this PPE for the first time, and it's a new experience. So tell us a little bit about your impression of how the staff at Memorial Hospital has handled this call to action.
Sure. Well, I'd have to say one thing that our staff have been from the very beginning is very flexible and tolerant and patient with the senior team and the many changes that we were making, that most hospitals were making as we learned more about this virus. Because if you can remember, very early on, the guidance was much different on personal protective equipment, masking, etc. And so oftentimes it could almost be a daily or weekly at the very least changes to the equipment that we were wearing, how we would handle COVID patients and patients under investigation, PUIs. And so we all really had to be patient in understanding that everybody was working hard for the good of all the hospitals, and that we would have to be flexible and be ready to pivot in a different direction very quickly. The fortunate thing is, one, we're a pretty nimble hospital. We're 500-ish strong, and we have great staff that love their community and love their hospital and are proud to work here. I've always loved working at a hospital in a town like North Conway because the people that work here, they live here. Many of them were born here, grew up here, went to high school here. It's not too tough as the president of a hospital like this to motivate people. They're already self-motivated, and they want this hospital to be a great hospital for the community in non-COVID or COVID healthcare needs. And I think they're doing that really well.
And I know the community has really stepped up to support them as well. Everything from restaurants delivering food to, I just saw that Mathisen North Conway is offering free oil changes to anybody. Just show your hospital badge and you get a free oil change. So is there anything else that the hospital needs from the community? Because these are tough times, not only for those seeking healthcare, but for those providing healthcare as well. Your whole kind of business model has really turned around. Is there anything that you need from us?
Yeah, so a couple of things, and I appreciate that question, Chris. One, first, I want to say, to your point, I want to thank the community for everything that they have done. I don't know if it can be completely appreciated how much our staff. Hold on, I have a pop-up. Let me get rid of that pop-up. Okay, how much our staff appreciate the support from the community, from the meals, from the cupcakes, from other treats, from donated masks, free things like oil changes. We just had more signs put up in front of our hospital saying things like, "You got this," appreciation. It's been great. I couldn't have imagined it being this well supported, and just want to say on behalf of the hospital, thank you. Second thing, I would ask that as we start turning the community and the businesses back on, I would ask that we not get relaxed in our social distancing, our masking, and just following those hygiene guidelines. I think we can turn the faucet back on like we talked about earlier in a phased approach, but still do the right things as far as masking, social distancing, and move forward and hopefully have a really good summer here in the Valley. And so I would say that. And then thirdly, I would ask that the community, if they have concerns about coming back here for time-sensitive care, or in the future when we do start other types of non-essential truly elective care, that they allow us to help them come back to the hospital to alleviate their fears. This is anecdotal, I can't probably prove it, but I feel like what we're doing here right now, as far as infection control and protecting people, not just from COVID, but from anything. I think we're as safe as we have ever been in our hospital right now because of what COVID has done as far as our attention to the detail of keeping things clean each and every day, every waking minute, for the good of our patients and also our staff and visitors. So I'd ask the community, come back, get the care that you need. Don't let it fester and get worse to where it's not just a problem, but it becomes chronic. And then we really have a difficult issue. So it's safe. Come on back. Give us a call if you have concerns, and we'll help you get back here and alleviate the fear that many of us still have, and rightfully and understandably so.
Right. Because there are many other health issues out there that aren't going away just because COVID's here. I guess the one of the points would be communicate, stay in touch with your healthcare providers, let them make the decision on the appropriate course of action. Don't ignore it on your own.
Clinician driven, I think folks know and believe and get the care here and have for years that we've got great clinicians that only have the best interest of our community and our patients in mind, and they will direct them the right way.
All right. Art Mathisen, president of Memorial Hospital in North Conway, part of the Maine Health System. Thank you so much for joining us.
You bet.
We will let you get back to your day. Please, I'd love to do this again sometime because things change daily, as we know.
Anytime, Chris. Happy to come on. Thanks for having me, and have a great Friday.
You too. We will talk to you soon. Bye-bye.